Welcome to Aga Hospital Kisumu Accident and Emergency Department. My name is Alfred, Mangera, the head nurse of the unit. In Aga Hospital Kisumu, we have a dedicated emergency unit. We have a resuscitation bay where we do resuscitation, and as you can see from the background, we have a number of equipment that aid in the care of their medical needs. There's a vast team that is dedicated for these services. This includes different consultants. We have dedicated nurses in the emergency room who take care of these patients after the assessment. We have multidisciplinary team that come along and respond to that. And one major advantage on top of that is that we have a special group of people, as to say, who respond to these emergencies, and each one has an assigned role during the response period of restoring the life of the patient who has been brought in. And the team comprises of multidisciplinary personnel of different specialties, and this is in accordance with the need of the patient. During an emergency response time, our priority is to restore life, to restore function to the affected limb. And at this particular time, the priority is given in medical care or even the surgical care that is required. And issues of finances are not a priority for us as Aga Hospital Kisumu, because we emphasize on saving the life as a priority. So we start with stabilizing the patient and ensuring that the right care is administered in the right time frame that is prescribed, and that helps in having the best outcomes. We have a defibrillator in the resuscitation bay. This defibrillator has other functions, and one of the major functions that is of importance is the ability to defibrillate a patient, especially if they require to be, if their heart rhythm needs to be shocked, so that we can resume a normal sinus rhythm, so that the heart can beat at the normal pace. So it also has other functions. The major function is the ability to deliver shocks according to the energy that is selected. It also serves as a monitor, and this is a crash cart. As you can see, it is quite small, and each drawer has what is required for us during the emergency response. So this is right with us here in the resuscitation bay. We have a section for emergency drugs. We have a drawer for circulation items. We have a drawer for airway items. We have a drawer for another drawer for airway, breathing, and then we have other additional equipment. We also have a CPR board that we place below the patient before commencing our chest compressions, which is quite important to enable us to attain the depth and to ensure that we offer a high quality CPR. The other added advantage of the defibrillator that we have is we are able to monitor the rate and the depths at which we are offering our chest compressions, if they are adequate, and we have this gadget that is built alongside with the defibrillator. Now in the monitor function, it does that for us. In the event that we have to give other drugs that require continuous infusions, we have infusion pump. We have an infusion pump. We have an infusion pump that is readily available. We have a syringe. We have a syringe pump. We have an infusion pump. We have oxygen. When we have a suction apparatus that is ready for use. So as the set is, it is readily available for use at any particular time. And we have one of the latest state-of-art monitors that measures quite a number of parameters, and this helps us at time of resuscitation. So we look at different parameters during that time and intervene as per the need. This is a ventilator, and we use this in the in the patients who qualify to be intubated, and we start mechanical ventilation, or even we start mechanical ventilation from the emergency department as we work our way out to the intensive care unit. So it is designed in a way that we are able to move to the ICU while the patient continues to receive care. We also have an ECG machine that is assigned to the emergency department 24 hours. So the ECG machine helps us in getting the rhythm of the heart and looking at other parameters to determine the functions of the heart at the time that the patient has just arrived. So this is usually done immediately upon arrival, so that if there is need to intervene in the cardiac issues, we get the cardiologist on board immediately. Alongside that, we have other specialists. We have the neurologist. If we have a suspected stroke, we also have a nephrologist in case where we have suspecting acute kidney injury and we have symptoms that are pointing towards that. And we also have physicians, emergency physicians who also respond according to the need of the patient. And we also have an endocrinologist in the cases where we have cases like diabetic ketoacidosis. So the endocrinologist is called on board at the time of emergency, and he gives a plan of care alongside the multidisciplinary team. So most of the time, the patients who arrive in the resuscitation bay most often require a multidisciplinary approach to help come up with a definite plan of care within a short time of period. So in the accident emergency department, we also have a dedicated isolation room where patients whose conditions require isolation, we bring them into the isolation units inside the room. We also have the same apparatus that are required as in the resuscitation bay, so it makes it quite easier to attend to any type of patient who requires to be isolated. It's also equipped with negative air pressure, and that makes it easier for us to attend to patients who require isolation. Within the emergency department, we also have a dedicated pharmacy that stocks the most frequently used drugs in the emergency setup. After stabilization of the patient, according to the care that is required of the patient, is to proceed to the theater, we proceed to the patient is to proceed to ICU, we proceed to ICU. The patient has been stabilized and needs to be monitored for a while before going to the next point of care. Then we have an observation unit, which I can have a quick look at. In the observation unit, we also have fully functional operator, suction operator. We have oxygen, we have a, we have multiple monitors, and this helps in monitoring the patient while still in the observation unit as we wait for the next care to be provided, or even the patient taken to the ward after stabilization.